An integral part of the healthcare service and criminal justice system. People who die due to unnatural causes, like poisoning or gunshot wounds, undergo autopsies to determine the cause of death. The science is imperative to secure convictions in cases of foul play.
We've created an institute where all of the ologies of forensics have come together, so so it's all in-house and under one roof, which helps with the chain of evidence and the justice processes. So we have toxicology laboratories, histopathology laboratories, molecular, which is a genetics laboratory, entomology, which is bugs and flies and maggots, and anthropology, which is looking at skeletons, and odontology, which is looking at teeth. So we're bringing all of those ologies and those sciences together to assist us as forensic pathologists to put the pieces of the case together for the criminal justice system. The other thing that's here is an imaging suite. So at the moment we've got a Lodox X-ray machine, and we're hoping quite soon to get a CT scanner, so that will augment and aid the autopsy process. It's in line with international best practices.
Touted as the first institute of its kind in the country and possibly on the continent, authorities say it plays a critical role in the gathering of information around violent crime.
This is a critical component of fighting crime, and so it's not only about getting the conviction, it's also about fighting crime. That's why this facility is so important, that it goes back into policing decision making and talking about, how do we use this data to help the police and the anti-gang unit, and saying that this is the GIS map of where it's happening, how it's happening. I mean, they were telling me now that in the last couple of weeks, the number of bullet or gunshot deaths in our province has escalated, and of course all of those citizens that are shot end up coming here if they're killed because of a gunshot wound. They end up coming here.
The facility was due for completion in 2021, and while it is operational with 400 post-mortems performed here each month, the facility is not yet being used at full capacity.
The snags included that the tables where it's difficult to adjust them, because it also has to accommodate students that are on training. It might be the postgraduate students, like the medical specialists who are training to be forensic pathologists, or any other students, or even with the South African Police, where probably the body needs to be put up there on display, but through a window, and then they can be able to use the auditorium. So that kind of a table could not be adjustable. So that's why it is taking so long. There are many other, and the other part is about the extraction. There's one area, one of the labs, where you'll find that there is not much of the air conditioning. So now I brought the premier so that could be able to see for himself.
The building has been designed to minimize the trauma for bereaved families who have to identify bodies of their loved ones, and include separate viewing rooms and a reflection garden. Vanessa Puna, SABC News, Cape Town.